Welcome to Nursing School Explained and this video on how to rapidly administer an IV push medicine. And what we're going to use today is adenosine, which we use in the treatment of supraventricular tachycardia. Now, this is a very special skill, but it is so important. And the reason that we need to administer the medication by a rapid IV push is because it has a very short half-life. So if we don't get it into the patient fast enough, it's not going to work. So the best thing to do is use a 3-way high-flow stopcock. And what this looks like is just that. So it has 3 parts to the lure lock, and then it has the dial here. So wherever the dial goes means that it's locked. So if I put the dial in this position, it's going to be locked from this way, and I can only push medicine through these 2 ports. If I open it up this way, the medicine or the fluids can flow through here, but this top one is blocked off. So what we'll do, here's our patient. I have the IV Cathlon sitting in the bowl to collect any fluid. We're going to use the port that's closest to the patient. So of course, first we want to go ahead and clean the IV site. And this typically happens in an emergency setting. So of course you need to be very quick, and you also need to explain everything to your patient as you would usually. So then we'll go ahead and we'll hook the 3-way stopcock up to the closest IV port to the patient. So now you can see what that looks like. So now I have 2 options here to have 2 additional syringes hooked up. And what I have is I have drawn up my adenosine 6 milligrams, which is the first dose, and then I have a 20 ml syringe with normal saline. And it would be the best if you had 2 nurses here, one pushing the adenosine and the other one pushing the saline, so that we can get the medication into the patient very quickly. Now we want to go ahead and shut off the clamp to the IV for the administration of the medicine, but then we're going to open it up after we're done. So we're going to give the adenosine first. We're really going to just slam the medicine in, and then right away turn the stopcock so that it's now open to the other side, and then we're going to slam those 20 milliliters as fast as we can. So now one syringe gets attached to one of the ports, and the other one to the other port. Now keep in mind here that whichever one the big yellow dial is turned towards is the one that is locked off. So now, of course, we also need to be sure that our patient is on the cardiac monitor, the provider is there, we have the emergency equipment at the bedside. This is a very serious emergency situation. We're only going over the medication and how to use the stopcock in this video. So make sure that you know everything there is to know about the medication and any safety procedures or safety precautions we need for the patient. So in this case, we have the line between the adenosine and the patient here open, and the 20 milliliter syringe closed. So then we also need to make sure that we have the line to the patient open. Of course, we want to make sure that the line is patent, but we'll say we've already checked that. So then I have one nurse pushing the adenosine and then quickly turn the stopcock over while the other one is pushing the 20 mLs. Now, as you can see, I'm only one person today, so we're going to do the best we can. So we've done all our patient rights and we are ready to administer this medication. So everything is open. We'll go ahead and really just slam that medicine, turn the stopcock, and then slam the 20 mLs, flushes as fast as we can with the least resistance. Flush, 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 and then turn this off and turn on the other normal saline that we have going through behind to carry any rest of the medication in there. Of course, in the whole meantime, we've been watching the patient, seeing them hopefully convert back to a sinus rhythm of some sort, and we're all good. And this is really the only reason that we need to use this 3-way stopcock, unless there's maybe like a blood draw or something like that going on. So thank you so much for watching this video. We can go ahead and take all this off, and then the luer lock, the regular luer lock, will be ready to use for any kind of other medicine we'll need.